My name is Laurie Brooke, and I'm a member of the Hopkins USA team. Our job is to help the patient navigate through the Hopkins system. We help you get with the appropriate specialist for your individual diagnosis. We'll walk you through the process. We'll help with gathering medical records, demographic, and insurance information, and we'll be your eyes, ears, and legs here at Hopkins before you make the trip to Baltimore. What you would do is you would call and speak to one of the medical concierges. We would take some information over the phone. Depending on the diagnosis, we would ask for current medical records, demographic, and insurance information. Once we receive that information, we will then send it to the appropriate specialist for review. We'd like to tell patients 3 to 5 days to have the medical records reviewed, depending on the diagnosis. Once it's reviewed, you and your medical concierge will work out a mutually convenient date to come to Hopkins. It can be anywhere from 4 to 6 weeks, depending, once again, on the diagnosis. The hospital has many security guards that will help you get through the many halls and corridors of Johns Hopkins. Your medical concierge can also provide a map and an itinerary for those multiple appointments. Most physicians like to have that initial consultation. That way they can talk about treatment plans and treatment options. At that point, they would then go into whether surgery is an option. There is every once in a while in that unique case where the physician will agree to have the initial consultation and do surgery on the same trip. When you check into the clinic, you can request a copy of your current medical records from Hopkins to be sent to your physician once they become available. We like to ask patients to stay at least a day, an additional day, so if there are any testing requirements or the physician's asking for additional tests, we can get those scheduled. We do work with most of the hotels in the Baltimore area, and we do have a guest services team that will walk the patient through getting the best rate. Most of the hotels are within a mile from the hospital, but most of them do offer shuttles or taxi vouchers, and the medical concierge can walk you through that process also. There's lots to do in Baltimore. We have access to many museums. We have the Baltimore Museum of Art. We have the Baltimore Aquarium. We also have the Maryland Science Center, and Washington, D.C. is only an hour away. Most of the times the patients will reach out directly to their physician, but if you do have any questions or concerns, your medical concierge can also assist you with that. Hopkins does participate with most insurances. What we like to have patients do is to call their insurance company and ask if Hopkins and the Hopkins physicians are preferred providers. That way, with your individual plan, you will know if it's covered or not, or what your out-of-pocket fees may be. The medical concierges are always available by phone, so if you do have questions or concerns, you can always reach out to your medical concierge.